There's a couple of really neat qualities to mini dental implants that I think that some dentists kind of neglect when they decide whether or not they're going to use or not use mini implants in their practice. The category of mini implants really is small diameter implants, and we understand that the smaller the diameter of the implant, the better ability it has to fit into thinner bone. And one of the benefits of mini implants is that when you have a tooth removed, the bone resorbs, and it usually resorbs from a width perspective first. So the width will collapse. You take out the tooth and the width collapses. It slowly starts to shrink in height as well over time. But that width collapse is really the reason why mini implants are so powerful, especially in the lower jaw, right in the front, where we do a lot of denture stabilization with mini implants. That being said, we can do this in a minimally invasive way now that we have mini implants. Meaning we don't have to use bone grafting. We don't have to cut the gums. We don't have to use stitches. We don't have to wait a lot of time. So all of the benefits of why should we be using mini implants in resorbed or thin ridges, that's the reason why we have chosen as a company, and me personally, to support the use of mini dental implants for multiple purposes. Standard dental implants have larger bone requirements. Oftentimes when you take out a tooth, you do not have, if you just let it heal on its own, you do not have the amount of bone that's needed to place a standard implant after healing. And so your dentist might say something like, okay, we'll take out the tooth today, and then you can go and see somebody else to have the implant placed. And what happens is, after 3 months of healing, you follow the instructions, you go to the specialist practice. They'll take a look at the bone and say, oh, you don't have enough bone, it collapsed. We have to do bone grafting first. We have to do this procedure first. Now, rewind just a little bit and think about what could have happened. If the dentist that removed the tooth also did bone preservation or socket preservation procedures, they could have had a single stage surgery at a much less expensive cost to add a little bone to that hole and then put a couple of stitches in at the same time as the extraction, helping the healing process, preserving the bone structure. And that being said, you could also have had an opportunity to take out the tooth and put the implant in right away. And that does everything, all the surgical procedure in a single visit. And so talk about benefits to the patient. That's why I usually say to patients, okay, so in the future, when somebody wants to take something out, make sure that they also have a plan to put something in. Because if they don't have the plan, they don't know what the plan is, they're creating the canvas or the foundation for the implant in the future maybe without considering it. So they don't even know that they're creating that. Or maybe they know, but they don't want to deal with it or don't have the skills to deal with it, or are thinking maybe they're going to do something like a bridge, a fixed bridge, or even a denture. All are reasonable options so long as I think they're presented initially. That initial presentation of what are we going to do once we pull this out. Also, from a patient's perspective, maybe they're in a lot of pain and they just rip it out, doc. I just want to get it. I want to get it out because I don't feel good. And we can totally understand that. To some of our patients, I say, okay, let's get down off the ceiling. Let me numb you up first. We'll deliver some local anesthetic to the area. You'll feel better, and then we can have a calm discussion surrounding what we should do, because it's in your best interest as a patient to understand what's happening before we do it. You're really setting the groundwork for the future.